Good afternoon, North Dakota. Grateful for your presence here today, and grateful for your tuning in and keeping your curiosity up and learning more, and also grateful that you're spending a little time with us before Memorial Day weekend, one of our most sacred holidays. As we've said in recent days, we know that as we increase the amount of transmissible moments, if you will, the amount of contact with this virus, because this virus moves most effectively when it moves person to person. We know that we were going to be seeing more transmissible moments. We also knew that as we got our testing capacity up and our contact tracing capability up and doing more targeted testing, that we were going to be seeing some more positives. And again, as you've seen multiple days this week and again today, we're going to see rises in our absolute number of case numbers. But I do want to start out by saying, again, to our leaders across the state, the phase that we're in, we had a great call yesterday with mayors, county sheriffs, county commissioners, and other local leaders from across the state. And all the leaders at the local level are in the business now of managing risk because the virus is here. It's invisible. We can detect it only through testing, and there are not tens of decisions, hundreds of decisions, thousands of decisions. There's literally hundreds of thousands of decisions that are being made at all levels by businesses, by churches, by local governments, state government, to try to decide how do we manage safely the interaction between 760,000 citizens plus all the visitors that may be coming to our state. And those decisions are challenging and they're complex and they're hard to do because we have no leaders have been managed through a global pandemic like this, at least in this generation of leaders. And so again, I want to compliment all the leaders at all levels, whether it's at the school level or the park district level, decisions about opening up playgrounds and summer pools and swimming lessons and demolition derbies and racetracks and street dances and county fairs. There are just, again, thousands of decisions to be made. And I want to say that, again, thank you, because through all of this, it's the excellent response at the local level from all these organizations and individuals and businesses that has allowed us to both save lives and livelihoods. We've managed to have some of the best numbers in the nation while being among the least restrictive states. And at the same time, we've built up enormous capacity for testing and contact tracing, which has taken us ahead of nearly all other states in those capabilities, and the ability to test and to trace and isolate are not for any other purpose other than being a path for us to have a healthy and prosperous recovery. We've managed risk early on by more aggressively slowing down transmissible moments. This allowed us to build up time to build up hospital capacity, which again we've done, and thanks to all in the medical community that have participated for that, because we've got a lot of testing capacity, we've got a lot of contact tracing capacity, we've got a lot of spare hospital capacity, so we're in a position where we can continue to move forward, adding more transmissible moments and then managing that risk going forward. And that's the business that we're in right now. All of us is managing risk because there's no way to eliminate risk at this moment related to this disease. Today, the health department confirmed 90 additional cases of the novel coronavirus disease, or COVID-19. Out of a good day of testing, 2,477 total tests were completed by over the 24-hour period that included yesterday, Thursday, across all of the different participating laboratories. This brings the total positive test rate that we're reporting today, but for yesterday's test, to 3.6% among all the tests completed in North Dakota. That's slightly below our from the beginning of the health crisis forward, the 3.7 cumulative rate. And so again, that's a good space, always good to be below our cumulative rate, and always good to be in this 3% rate. That leaves us in the position of having the state with the 5th lowest percent positives in the nation. We have also completed 62,830 individual North Dakotans have been tested during this time frame, and that's again a number 2 per capita in the nation at that level. When we take a look at breaking it apart between those that were tested, newly tested North Dakotans, and those who had been tested prior, we're starting to break out this data, the serial test as they're called, if someone is tested a second time. We had 926 individuals who had been tested at least one time before, and of course many of these are people that work in healthcare or reside in long-term care facilities where we've had outbreaks over the past month. This means that cumulatively, in addition to the 62,000 plus individuals that we have tested, there's been almost another 15,000 tests that have been completed by the state lab and our lab partners, so 77,447 tests, completed tests that have been done so far. When we take a look at the net case breakdown, which again is really how we think about the activity we have to manage right now, we have 860 active confirmed cases in the state. Recovered cases today were 65, and so that's a net increase of 25 over the reported numbers that were reported yesterday. We have seen out of this entire journey we've been on, 1,405 individuals have recovered, and sadly there have been 52 deaths, including one additional death, a man in his 80s with underlying health conditions from Cass County who died with COVID. Catherine and I, of course, extend our deepest condolences to this family who lost their loved one, but also to every North Dakota family and community and relatives who are grieving the loss of a loved one from this global pandemic. We are saddened as each of us can be from the loss of these 52 deaths. We have to also be reminded in a moment of gratitude that here in North Dakota that this is less than 1/20th of 1% of all the deaths in America that have happened during this pandemic. The CDC reports today that cumulative through this event, 94,000 Americans have died nationwide with COVID. And again, 1/20th of 1%, or 52 of those here in North Dakota. So again, the gratitude that we share that North Dakota has largely been spared from the ravages of this pandemic. The President of the United States issued a proclamation last night in honor of those 94,000 individuals who've passed away with COVID, asking that states fly flags at half staff until sunset on Sunday, May 24th. And in compliance with this, late last night and early this morning, I also issued a proclamation for state facilities in North Dakota to follow and match this nationwide proclamation, and that's through Sunday, May 24th. And of course, Monday being Memorial Day, the tradition there is that flags will be flown at half staff until noon when they're raised as a recognition as part of that memorial of the ongoing freedom and liberty that those individuals who gave their lives for our country have gained for us. But flags will be at half staff through noon on Monday, through the weekend for the 94,000 people who passed, and Monday morning for Memorial Day. Currently, 39 people are hospitalized. That ties our new high number set yesterday of individuals hospitalized at one point in time. This represents only about 2% of our capacity, and only about, I think the number is actually 14 of those 39 are in ICU. But for those that are hospitalized or in ICU, we, of course, our thoughts are with them and wishing them a quick and full recovery. If we look at our positive rate of 14-day rolling average, which we've done, today's rate is slightly above of yesterday. They're both listed there as 2.9, but I think yesterday was a round up from 2.85, and today we're at 2.93. So this is moving slightly up, but again, it's remained under 3% as on the rolling 14-day average, which is again relative to virtually almost all other states, a great place for us to be right now. So again, nice nice going, North Dakota. When we do take a look at the tests earlier in terms of that 90 tests, I do want to point out that 74 of the 90 were in Cass County, or 82% of the positive tests were in Cass County. We continue to work very closely through the Red River Valley COVID Task Force and work with officials in Fargo and Moorhead and West Fargo and Cass County and Clay County to make sure that things are going well. Contact tracing efforts are going to continue through the weekend. There's going to be some testing efforts going on conducted by the state tomorrow, and so we will again stay on guard and vigilant across the state, but particularly in Cass County, which represents the majority of our positive cases at this moment. The next topic that we're moving into has to do with additional North Dakota Smart Restart guidance. As we know, throughout this entire battle, that we've managed here in North Dakota with a great formula, and that's a light touch of government and a strong reliance on individual responsibility. We all know that it's not what government says, it's what people do, and it's the actions of individuals that prevent the spread of this virus from person to person. And with that, I would just want to also again lead with a great thanks to all of the businesses and the educational institutions and the health organizations and just families and individuals that have done a great job in adopting their lives during these uncertain and challenging and uncharted times to new behaviors and new approaches, which has slowed the spread and surely saved lives right here in North Dakota. When we entered this with a light touch, we were focused on executive orders where we did mandate the closures of certain businesses that had high amounts of transmissible activity, including places where there was high customer contact, whether personal care or other establishments. And those, again, we've opened those up. When we opened them up, the executive orders had a clarity in there that when we were reopening, that the guidance was also something that could be enforceable in terms of what they had to do. Other businesses that we never closed at all, say banks, say churches, say any of those, when we were offering guidance, it was strictly guidance. So in a measure of equity today, we are reissuing the Executive Order 2020-06 with a revision, so it'll be 2020-06.7. And in this, the guidance that was in there becomes guidance or recommendations, and we've removed all references to compliance, enforcement, and penalties to put the responsibility where it matters most. It matters on individuals, safe practices that individuals take and businesses take with their customers and team members to spread the slow of the virus and ensure consumer safety, which is, again, the path that we must continue forward on to attain our full economic recovery. By transitioning these protocols to recommendations and guidance from enforceable rules, we can ensure consistency across all categories of business types and avoid confusion when we get to the level of potentially county level monitoring, as if we move from threat level 3 to threat level 2. That could potentially change based on county by county, but this way across all business types, everyone will understand that these are recommendations and guidance. I want to also say that the language in this executive order includes the following words because, well, this is a recommendation or guidance as opposed to a rule. It says strongly encouraged to adopt and rigorously follow. So again, while we're eliminating, if you will, the legal compliance requirements with this, we remain strongly encouraging all businesses, whether you're a bar, a restaurant, movie theaters, or other gathering places, if you're in the personal care business, all the places where before we had enforcement language, that's been removed, and it's been removed because of the great work of all of you in those businesses. But again, we strongly strongly encourage you to adopt and rigorously follow the guidelines that are now there. To date, businesses have done great steps to keep employees and customers safe by adhering to the protocols, and this change will allow businesses to continue to consult with their team members and their customers and their industry groups to adjust their practices to assure continued safety and infection control in a manner that meets or exceeds the recommended protocols. This also empowers businesses to make the best and safest determination of what they need to do based on their own physical layout within their locations. Ultimately, businesses that are going to survive and thrive are those that are going to restore consumer confidence through their actions and their attention to customer needs, especially when it comes to making customers feel comfortable as we all navigate our way through this ongoing health crisis. And as we, transition from, for what some businesses would have set of legal requirements to guidance and recommendation, we must also remember that every North Dakotan has got a personal responsibility to be North Dakota smart and follow the guidelines to limit the spread of this deadly disease. I do want to close with two other thoughts. One is, one might take this interpretation is that, hey, there's no longer enforceability to these. That's just strictly guidelines and proclamations, and so we're gonna let her rip, as they say, and it's Memorial Day weekend, and let's party on. It's clear that even as we loosen up these and move from legal requirements to just simply recommendations or guidelines for those businesses that had previously, during the middle of this pandemic, been closed by executive order, that both the local health officer and the state health officer, between those two, they've got clear legal authority about requesting quarantines. The state health officer still has clear legal authority to close businesses that represent health risks to the public. And so again, if somebody decides they want to let it rip and there's a large breakout that's traced back to those, to that either facility, whether it's a business or a place where customers go, there still is the ability, and we will, to protect public safety, take actions as needed to make sure that we're ensuring public health. So again, this is up to each business to make the smart decisions about how they restore their customer and consumer confidence, and they take actions that allow them not only to reopen, but to stay open, operating a safe and healthy business. And as we do that, again, in our state, there's no requirements regarding wearing masks, but and we're all in this together, and there's only one battle we're fighting, and that's the battle of the virus. I would really love to see in North Dakota that we could just skip this thing that other parts of the nation are going through, where they're creating a divide, either it's ideological or political or something, around mask versus no mask. This is I would say, senseless dividing line, and I would ask people to try to dial up your empathy and your understanding. If someone is wearing a mask, they're not doing it to represent what political party they're in or what candidates they support. They might be doing it because they've got a 5-year-old child who's been going through cancer treatments. They might have vulnerable adults in their life who are currently have COVID and are fighting. And so again, I would just love to see our state, as part of being North Dakota smart, also be North Dakota kind, North Dakota empathetic, North Dakota understanding to do this thing. Because if somebody wants to wear a mask, there should be no mask shaming. You should look at them and say, that person's wearing a mask because for them, there's additional risk in their life. This is not a disease that spreads risk equally. If you're young and if you're healthy, and if you've had no underlying health conditions, you may feel, as a lot of young people do, that you're invulnerable to this. But there are many people, 20% of the population of our state of North Dakota, have a real reason to fear that catching this could lead to serious illness, long-term health effects, or even death. And so again, I ask people to respect that. And if you can't get there on masks, let's just go to another place, which is, when we were kids, nobody wore bike helmets. And we transitioned into a world where when you see somebody wearing a bike helmet, you don't think that they're goofy or nerdy. You just think that the parents and the kids are being smart, because we know we can stop, senseless brain injury from simple accidents. And it used to be 50, 60 years ago, professional hockey players didn't wear helmets. Now they all do. And even in the last 5 years, there's some old bull riders that are still wearing their cowboy hat. But you see any young bull rider on the tour that is coming out of college, they're all wearing flak jackets and they're all wearing helmets. And they do that for a good reason, because they know that there's safety involved in that, and they're making a personal choice. It doesn't make them less of a bull rider, and they don't win any less money if they're wearing a helmet than if they're wearing a cowboy hat. But the other thing about this is people that might wear helmets for hockey or bikes or for bull riding, they don't wear them to bed. I mean, there's a time to wear a helmet, a time to not. And there's a time to wear a mask and a time to not. So if somebody wants to get out for the first time and go to a crowded restaurant and they're going to wear a mask when they're coming and going as part of that thing, we should welcome them and support them. And in businesses that want to provide masks for their customers, again, you'll be reaching a segment of the population that may feel comfortable going there. But let's again, if we in North Dakota can avoid the mask, no mask divide, let's just focus on understanding what each individual might be going through. Okay? Next topic, state facility update. We had questions earlier this week about when state facilities might be opening up, and today you have your answer. Amended Order 2020-06.7, the same one I just referenced, related to making changes to guidance and recommendations for all businesses to put them on equal footing. Also has some paragraphs related to access to state facilities across the state. And again, as I've mentioned, the state has over 1,600 buildings spread all across the state of North Dakota, including, of course, the state capitol. They're going to be subject to the North Dakota Smart Restart state facility protocols effective on June 1, so that's a week from Monday when they'll be reopening. There was a question about public tours. Public tours of the state capitol will remain suspended until further notice, and there'll be a separate notice on those. But those who are entering the state capitol and other state facilities, whether you're a citizen coming for an appointment or to handle some business, or whether you're a team member, will be subject to wellness screenings coming in and out of the building. This is a practice that many businesses are doing. And while not required, masks are strongly recommended for team members and citizens when they're in the public areas where physical distancing may be difficult or not impossible, such as when entering or exiting the building, or in common areas such as stairwells or elevators. And state facilities initially will be limited to a 50% capacity to limit close contact. Extra hand sanitation stations will be set up, and again, we encourage that if you're a citizen that has got underlying health issues or are elderly, consider conducting your business with the state of North Dakota by mail, online, or by phone, even as we open up, again, to protect yourself and your loved ones. And again, in terms of the guidance that we're offering here, this is being put out, of course, to all agency leaders. Elected officials have the opportunity to make their own decisions about how they want to manage their own teams. And of course, as elected officials, I'm sure we'll also be taking a look at the North Dakota State Health Department guidelines as they make their plans. But collectively, we want to keep the density in the building down. Each agency leader and each elected official has got different space requirements, different levels of density, and so this is why, again, delegating this authority to all of these groups, that everybody can make their own decisions, because like every employer, the state of North Dakota, our #1 priority is workforce protection. For us to be able to serve the citizens of North Dakota, we've got to be able to keep all of our team members healthy so that they can be serving all of you. And again, agencies are being asked to review these guidelines, apply them to their specific office environments and continue to observe the CDC guidance for events, meeting, and workplaces. We do know that there are team members who, as part of their job, have little or no citizen-facing roles, and they have the opportunity, will have the opportunity to continue to be part of the remote workplace workforce. As we keep density down, supervisors will be coordinating with their team members to determine which team members would be most applicable for them to return and which ones would be most applicable for them to continue to work from home, particularly as it relates to the citizen-facing roles. We are, again, as part of this work, there'll be guidelines that include teleworking policies and procedures, teleworking guidance, and the new workplace return strategy. I again want to go back and thank all of these fellow elected officials and agency heads, because in less than 48 hours in mid-March, we moved more than 7,000 team members to a remote work environment, and since that time, they've continued delivering the needed services to our citizens. We look forward to safely bringing back members of Team ND that will be in citizen-facing roles and whose on-site work helps provide those services, even as we continue to make investments to digitize more and more of the work we do and improve business processes so that citizens don't have to spend time coming to the Capitol here or other state buildings, where if we can get them to get their work done remotely, that saves taxpayer money and saves citizen time, and those are two things that we want to do going forward. Next topic has to do with CARE-19. There's been a series of media reports that came out yesterday and this morning about the CARE-19 tracing app. I say briefly, because our statement put out, our office put out a statement on this, which you should all have received, and anyone can find that statement on the website at governor.nd.gov. I need to repeat, and I'm smiling because we've said this so many times, CARE-19 does not require or utilize names, addresses, emails, or phone numbers or other direct personal information. None of that's entered in the phone. The data on places that is in this thing is by the user is held securely in the ProudCloud servers. ProudCloud is Tim Brookings, the developer of the Bison Tracker app, and the only information that exists there on those servers is a randomly assigned anonymous 32-digit number. So again, if you got to look into a ProudCloud server, you would see a bunch of randomly assigned 32-digit numbers, and you would have no ability whatsoever, no matter who you are, even if you're brilliant as Tim Brookings, to be able to identify whose 32-digit numbers those were. So there's the reason I'm smiling is because there's really no data that can be shared from this application that is useful to really anyone. So let me also be clear that none of this data is being shared or sold for commercial purposes. And of course, the reason is why it's not being shared or sold is because there's no data there that's of any value. The anonymous information CARE-19 is gathering can save lives smartly and safely using technology in one more way to help us speed up our economic recovery. That's the point of contact tracing, is so we can do, if we have an outbreak in the months or weeks or years ahead, that we have an opportunity to isolate those individuals that were exposed and keep the rest of the economy rolling. Some of you may have heard of a third-party company called ForceBase. Some small businesses use this as part of their retail, checkout for payment services. And as part of registering on ForceBase, people might list the name of their business so that you might know, say, where a local small business is, a retail shop, or a McDonald's. And again, that is now clearly noted. It was clearly noted before. The word ForceBase came up on the interface, but the only thing, there is information only flowing for people. This CARE-19 is a diary that helps you track where you go. One of the aids is if it can automatically, spontaneously to your 32-digit anonymous numbers highlight to you the name of the business that you stopped at. That's a useful tool. And then again, Care 19 privacy policy, which has been revised, explicitly calls out this usage and makes clear that Foursquare does not store it, not use it, not keep it. They discard that data and they don't use it for any marketing purposes. And this is part of a software developer kit from Foursquare, which is free, so no one had to pay for that access. It's available to all app developers. And again, as part of that agreement with Foursquare, they don't track or keep or use that. And again, there wouldn't be anything there for them that would be useful to them anyway. I also want to remind people this is a completely voluntary app. If people have concerns at any point in time, you can push the erase data button on your Care 19 screen. It'll erase all of your data that you've had on there before. You can get rid of the app totally. But again, we want to make sure that people know that this app was designed completely around privacy, and that's why it was designed to not have any user data in it. And again, it's been also pointed out that the third party that was involved in this write-up is a company that sells privacy. They try to get you to buy their app, and so there's a motivation for them to try to say things like this so that people might go buy their app. But again, Care 19 is totally anonymous, totally private, and the Care 19 diary, which is what we're talking about, which has the location tracking information, is information that you can use if you're contacted by a contact tracer to jog your memory about where you've been and who you may have been in contact with. There's the second app, Care 19 Exposure, which is coming in a few weeks, which will utilize the also completely private Bluetooth technology that's coming from Apple and Google, that collaboration and interoperability for those two, and that will again provide an opportunity for you to be notified if you've been exposed without you giving up any of your personal information. So thank you for sitting through that tech briefing about the underlying functionality of these two applications. But I would also just say that if you're using Facebook or Google Maps or Twitter or any of the other 50 apps on your phone, they have way more access to all of your information, and that's why you get targeted ads. Care 19 is about the most secure thing you could possibly have on your phone of all the apps that you have. And for people that are saying, wow, I'm being targeted with apps, let's go all the way back to television. When television first occurred, the reason why television was free when you had the little rabbit ears on top was because you got free television if you were willing to listen to the apps, you're willing to listen to the advertising, which came for as many as 13 minutes out of 30 minutes in a half an hour show, when the original TV model was built on advertising that you had to consume to watch your content. The fact that you've got access to search informations from various companies and can store all of your videos online for free. For example, you've got access to hundreds of billions of dollars of free technology, and the reason you do have that access is free is so that advertisers can advertise at you. And there is a lot of tracking of your personal information that allows them to do targeted ads. Care 19 is not participating in that entire commercial endeavor, which fuels, all the free apps that many of us enjoy on our phones. And so again, I'm smiling because it's unusual that the app that has no commercial benefit, no data to sell, and has no commercial profit model about selling advertising or sharing information with advertisers and has no data to share is the one that's being scrutinized, and others that actually have this as their commercial business model that have helped build trillion-dollar companies are not being scrutinized, so that's why I'm smiling. Okay, so enough of that. That was a little editorial on the end of the thing, but again, if you're using Care 19 Diary today, or if you're going to download the Care 19 Exposure, you're helping to save lives and you're helping us get our economy going. So thank you for participating, and thanks for being an intelligent consumer of technology. Next is the disaster declaration request. Today I signed a presidential major disaster declaration for widespread spring flooding, which is estimated in North Dakota to have caused more than $40 million in damage to roads and other public infrastructure. This request follows the executive order I issued on April 24th, declaring a statewide flood emergency. This covers the period from March 2nd to April 25th, when the Red River, at April 25th is when the Red River finally dropped below flood stages in Pembina. It includes 21 counties: Barnes, Cass, Dickey, Emmons, Foster, Grand Forks, Kidder, Lemoore, Logan, McIntosh, Nelson, Pembina, Ransom, Richland, Sargent, Sheridan, Steele, Stutzman, Trail, Walsh, and Wells. And river and overland flooding this spring caused significant damage to roads, bridges, culverts in North Dakota counties that were already heavily burdened by the recovery cost from the spring and fall flooding, the record fall flooding last fall. We certainly appreciate the Trump administration considering our request, which was again a 7-page letter which we signed earlier today. We're grateful for everyone at the Department of Emergency Services that worked to compile data to make the case for federal assistance, and thankful to all of those people at the county level and the local level who also submitted all of this information to help us make a strong request. So thank you to all those affected counties. If granted, this declaration would unlock additional FEMA public assistance dollars to help cities, counties, and townships pay for the costs of repairing roads and other infrastructure damaged by flooding. I also want to thank a number of legislators who live and work in those areas who've also been championing this disaster declaration request, and they've also been personally sending me photos of damaged roads at the township and the county level. And again, really appreciate the hands on the ground from some of our legislators who also are farmers and using those roads. So again, our citizen legislature, thanks for the collaboration there. Preliminary assessments indicate that the damage in the 21 counties is expected to exceed $9.2 million. Additional $2 million of damage still is underwater. The North Dakota Department of Transportation also reported damages totaling $29.7 million to its network of federal aid system roads. And as a reminder, President Trump and FEMA granted our request for a presidential disaster declaration last June in response to 2019 flooding in 19 North Dakota counties. So this is the second year in a row that we've been submitting a spring presidential flooding declaration, and we hope for the same positive outcome. The next topic is behavioral health. And the topic today on behavioral health has to do with grief and loss. And we know that this weekend, when we're honoring not only those that have given their lives for our country, we're now, for the first time ever with the Flags at Half Staff, honoring the 94,000 individuals who have died nationwide. And of course, we also honor those 52 North Dakotans who have died well infected with COVID-19. The act of saying goodbye to a loved one often begins well before the funeral or the burial, and for many people, the days and hours at the end of a loved one's life are especially tender and memorable and poignant. With the isolation measures that are in place in most facilities, we know that people are missing out on these important final farewells. This is true when people die from with COVID-19, but we also know that when people die suddenly, whether it's in a car accident, a heart attack, or other more rapid causes of death, that sometimes family miss out on this opportunity to, quote, say their goodbyes. Well, critical to slowing the spread of the disease, the isolation and physical distancing measures that we're going through right now can make it hard for mourners to come together and grieve. And we know in some cultures in our state, one of the biggest things that happens at funerals is all the hugging and the in-person embraces that go on, the sharing of food and gathering in close spaces, sometimes in homes. And again, this has been a challenge culturally. We know that a number of people have been postponing memorial events, people that have been doing that and pushing putting things out to the future where perhaps they can gather in a more traditional sense. But if this delay sometimes is causing people to maybe experience more increased sense of loss. And one of the time-tested ways of coping with loss and grief, of course, is social connection. And we know that that's being challenged right now. That's why today we're talking about it on the behavioralhealth.nd.gov website. There's information about grief and loss, 10 ways to support someone grieving during this emergency. It's got ideas about virtual memorials, candle lighting, storytelling events, offering emotional support, and how to access professional services. And we know that in lieu of traditional funeral gatherings, we know that families have gathered on Zoom or Teams calls and done things virtually. We know that people have created other forms of memories that they've built for their loved ones. But as I know, as all these people do from personal experience, losing a loved one, regardless of age or circumstance, is always painful. In a time when caring and protecting one another has to also mean keeping our distance, we know that this can be really difficult. So this is physical distance is an obstacle today. We still have ways to be there for each other socially and emotionally. And again, look for those ideas at behavioralhealth.nd.gov. On a North Dakota Smart reminder, we've talked about the importance of individual responsibility. We are taking steps towards increasing the amount of transmissible moments back in our economy. And we know that Memorial Day weekend is considered by many to be the first weekend of summer. And we know that many North Dakotans are looking forward to getting outdoors, whether it's to be going to the lake, take a camping trip, get on your bike or your motorcycle, fire up the grill, get with friends, get on the boat, go fishing. We know that this is what this means for a lot of people. We know that a lot of high school graduations have been completed. And we also know that for some folks in North Dakota that this is also a weekend of religious celebrations. We know that for others they're going to be celebrating the memories of loved ones. And we also know that across the state on Monday is a traditional day, the holiday of Memorial Day, to honor those individuals who've given their lives in the service to our country as part of their service in the military. And so no matter what your plans are this weekend, we remind people that continue to be North Dakota smart, follow the CDC recommendations on social distancing and personal hygiene. We are excited to be getting back outdoors and getting back together, but we also know that we'd like to not be 10 days into June and seeing our numbers climb as a reflection of all the interaction that happened over Memorial Day weekend. I'm guessing that may happen somewhere in the country. Let's not have it be here in North Dakota. And again, this may mean that each of you have got to find new ways or an opportunity to create new traditions versus the old ones that you've had. And again, it's everybody's responsibility to protect yourself, your family, your neighbors, and working together. And again, as I said earlier, if you see people that are out and about this weekend wearing a mask, give them your support, encouragement, because they may have a vulnerable person in their family. Next topic is around a couple things related to NDDOT. And the first one, of course, has to do with Vision Zero. Memorial Day weekend is traditionally a big weekend for travel, and I'm sure this may be one of the biggest ones this weekend because people have had time where they probably weren't putting many miles on their vehicles. We know that gasoline sales in the United States dropped to the levels of the 1960s, and people that are getting ready to get going. We may see that we've got visitors coming from other states to North Dakota because we're more open than and remained more open throughout the pandemic and are more open now than even some of our neighboring states. So we could see a lot of travel. We again ask people as they're here and on the road this weekend to drive safely, observe the speed limits, and of course don't drive impaired, whether that's drugs, alcohol, or dealing with your device or smartphone. No texting and driving. Texting and driving produces activity and results that are equivalent to being the same as drunk driving. And so again, let's be smart. If you're traveling together, together. If a driver is trying to text and drive, just offer to either drive or offer to, hey, I'll do that text for you. Simple things that we can do. And of course, one way to save lives is wear your seatbelt. In the fatalities in North Dakota, still the majority of the deaths that happen in North Dakota can be related to two things: impaired driving, typically alcohol, and not wearing a seatbelt. Those things are things that are alcohol and drug-related crashes, 100% preventable. If you're impaired, don't drive. And many lives would be saved each year if drivers made the choice to drive sober or designate a sober driver or use a ride-hailing service like Uber or Lyft. Excessive speed can also be a factor. We did see during the COVID-19 timeframe that speeds went up on North Dakota. Traffic went down, but speeds went up. We want to remind people, with more people on the road, again, pay close attention. The Highway Patrol, North Dakota's finest, who's been out working hard through this whole thing, will have increased patrols out over this holiday weekend, as they often do, and law enforcement will be stepping up on June 1 the Drive Sober or Get Pulled Over campaign to combat underage drinking and driving under the influence. We know that from motor vehicle crashes, again, are on the downslope in North Dakota because of the limited number of driving earlier in the year. We're actually have off to a unfortunate. It's unfortunate even when you've got the deaths that we have, because even one death is too many in North Dakota. So again, our condolences go out to those families who've lost 23 individuals on the roads so far this year. We like the trend line going down. The whole point of Vision Zero is that some days in North Dakota, nobody dies on the road. Sometimes for 2 days in a row, nobody dies on the road. Sometimes for almost a week, nobody dies on the road in North Dakota. We'd like this year to see if we can go a month without anybody dying on the road, then see if it can be 2 months. Then maybe we can do 3 months. And then some point in the future, again, whether it's practices individual responsibility or improved road conditions, roundabouts are saving lives as we get rid of intersections across North Dakota. So we're investing in infrastructure to save lives. But wouldn't it be amazing if we were the first state some point in the future where we went a year with 0 traffic deaths? And if you say that's impossible, then think about it. If it was your son or daughter or relative that died, then ask what the goal would be, because anything other than 0 is a goal that should be unacceptable to any of us who may know someone who's died in a car accident. So with that, good job so far this year, but let's keep the trend going. Let's have a Vision Zero Memorial Day weekend from a traffic standpoint. When we take a look at summer construction, which again, we're excited about this from an economic standpoint, but our NDDOT is going to be very busy. There's about $400 million of projects that are slated for this year. Those are already getting going. When you encounter work zones, put the phone down and slow down. In 2019, tragically, we had 2 work zone crash deaths on our highway. Our hope is that motorists can take necessary precautions when in work zone to make our work zone Vision Zero and make that 0 for 2020. And again, it's not only for your life and those with you, but certainly for all of the people that work construction for the state of North Dakota. Think about them and their families and slow down. And another last note, this is summer weather. We got more motorcycles on the road this weekend. Be alert, pay attention. Motorcycles, they have all of the same right-of-way rules that you do as a car, so give them room, and make sure that you, as they say, make sure you're seeing motorcycles. And just as we all have a responsibility to be North Dakota smart and slow down, we also got a responsibility to keep our roads safe with responsible driving practices. And again, Vision Zero, 0 fatalities, and also 0 excuses. So thank you and have a great weekend on the road. When we move into the good news piece, we've also had questions about parks and historical sites, and I want to share some more news about opening up and how you can enjoy our beautiful state this weekend. If you're heading out to one of our North Dakota state parks, you'll find that comfort stations, concessions buildings, and administration offices are now open for limited services. If you plan to visit one of our state parks this weekend, we encourage you to take advantage of online services, purchase your daily and annual permits online before visiting to limit face-to-face interactions. You can skip having to go into the administration offices. Just go ahead and buy those things, and you can make reservations for camping spots online online as well. We're also excited to announce that Lewis and Clark Interpretive Center in Washburn is once again open to the public. You can visit and learn more about North Dakota's earliest the early explorations of Lewis and Clark, and as well as the tribes that helped them through that historic time. And again, residents. They're open between 10 a.m. and 5 p.m. and they're open Tuesday through Sunday. So again, that seems to me, it looks like they might be closed on the holiday Memorial Day, but it looks like they're going to be open this weekend. And may have been noted before, when Lewis and Clark came up, they camped and were supported by the Mandan, Hidatsa, and Arikara Indians through that winter, and their entire group stayed 144 days. That is still the record. The longest time any tourist group has stayed in North Dakota was in the winter of 1804. So if somebody wants to challenge that this year, this is the time to do it. But again, for more information about services and access at our state parks, visit theparkrec.nd.gov. International Peace Garden, partially open today, U.S. visitors. The border, of course, is still got restrictions between here and Canada, but at this time, the grounds, the hiking trails, the campgrounds are open. Restroom facilities are open. Some buildings remain closed, but the Peace Garden is home to miles of hiking trails, scenic drives, historic monuments, lakes, and wetlands that are all teeming with wildlife. For more information, visit peacegarden.com. If you have not been to the North Dakota Peace Garden, this might be a good weekend to drive up there. If you haven't been to one of our 13 state parks, it might be a good time to visit them. And we have across the state many incredible State Historical Society locations, and most of those state historical sites will begin opening again tomorrow. And we, in keeping with North Dakota Smart Restart policies, sites will operate at reduced capacity to allow proper social distancing. Site tours may be limited. Touchable exhibits may remain closed. And then a couple exceptions here, the Ronald Reagan Minuteman Missile State Historic Site near Cooperstown. If you haven't been there, try to get there this summer. You can actually go down in a missile site, and it's frozen in time. It's as they left it when they decommissioned it. So pretty amazing. Down to the Life and Look magazines laying on in the rec room. The Heritage Center and the State Museum in Bismarck will remain closed at this time. There are a number of unstaffed historic sites, including Double Ditch Indian Village, Huff Indian Village, Minokan Indian Village, Fort Clark, Fort Rice, and Whitestone Hill. They will continue to offer free outdoor opportunities to explore trails and historic landmarks. For more information about state historic site opening services and hours, visit the history.nd.gov. And as we close, and again, I should say on that one, we got this great slogan this year that was pre-COVID, North Dakota tourism slogan this year was "Follow your curiosity, not the crowds." And of course, curiosity is one of the things that drives happiness. Stay curious like a child. Stay curious like your new puppy, and get a chance to get out there and learn across Parks and Rec, the Peace Garden, and North Dakota history sites. Follow your curiosity, not the crowds. You would have thought we made that knowing that COVID was coming, but again, practice that this weekend. On the gratitude side, want to also say we've got so much to be grateful for when we think about those brave men and women who have given their lives for our country. And as we get ready to enjoy this long holiday weekend, we want to take a moment right here to recognize all of those who not only served but died while serving in the military, and who we will remember and honor on Memorial Day. As a nation and as a state and as individuals, we owe our deepest gratitude to the heroes among us who stepped forward to defend our rights and freedoms as Americans. And we cannot ever take for granted those who have made the ultimate sacrifice. This weekend and on Monday, we encourage you to take some time and remember and honor those brave souls whose sacrifices need to be remembered and honored each year, and those who have helped us secure our rights as Americans. A number of traditional Memorial Day services have been changed to virtual or televised. And so again, if you in the past weren't able to attend because you weren't for whatever reason able to get to one one of these physically. Maybe we'll have even higher attendance this year than ever. But the annual Memorial Day ceremony at the North Dakota Veterans Cemetery is going to be a small group out there, including myself and other officials, and that'll be live streamed, and we invite you to join online at 12 p.m. Central Time at ndguard.nd.gov, and that's on Monday. That'll be live streamed, a live event, live streamed from the Memorial Day ceremony. It also may be carried, I think, on some television channels. A virtual ceremony is going to be held at the VA Fargo National Cemetery beginning at 2 p.m. on Monday, and you can attend that online by going to facebook.com/Fargo National Cemetery Committee. We know that across North Dakota there are many more communities and organizations finding North Dakota smart ways to honor our heroes on Memorial Day, and we encourage all North Dakotans to join in sharing our gratitude for the military members, and especially those who have made the ultimate sacrifice. And in concluding, let me share a quote from Admiral Forrest Sherman, the admiral who served both in World War I and in World War II. And on Memorial Day some time ago, he said, "Today let us as Americans honor the American fighting men and women, for it is they, the soldier, the sailor, the airman, and the Marine, who have fought to preserve freedom. It is their valor that has given renewed hope to the free world, that by working together and in discipline and faith, our ideals of freedom will always prevail." Again, Admiral Forrest P. Sherman. So tune in, noon, nd.guard.nd.gov for the annual memorial ceremony from North Dakota Veterans Center, and 2 p.m. On facebook.com, Fargo National Cemetery Committee for the VA Fargo National virtual meeting. And then for us, we'll be back here Tuesday at 3:30. And again, for those that sign off before we go to Q&A, thank you for your time and presence today. And until then, enjoy the holiday weekend, and remember to be North Dakota smart as you celebrate Memorial Weekend this weekend. Drive safe, be healthy, and now we'll stand for questions. We're going with Amy first, then we're going online, then back to you, Jacob.
Do you have any sort of a tally of violations that were issued when those restrictions were in place on restaurants and salons and businesses like that?
Answer to that one is no. Those would have.
I mean, I know in general, I think many businesses were in compliance. I know there were some that I've just heard about.
Yeah, if you heard about them, I probably heard about them. They were, might have shown up in a local paper. It would have been a local action that would have done it, but that was not data we were tallying here. I mean, I think by and large, felt we had as a state really high compliance around all of those guidelines and procedures, and we look forward to seeing that continue going forward. Online?
Mike Smith, 660 KUYZ in Williston. A few weeks ago, some legislators requested more transparency on the models you were basing your decisions on. Now your political opponent is filing a public records request. Do you feel that your administration has been transparent delivering data to the people?
Yes. I suppose I could elaborate. I'm smiling, of course, because we got people in this room that this is what your first 52nd press conference. In addition to the press briefings that we've done, I've lost count of the number of briefings we've had, the amount of information that we've got published on ND Response, the North Dakota Health website, the North Dakota Commerce website. There's enormous information, and we have. Been working diligently. We get dozens, perhaps hundreds of FOIA requests for information throughout this thing, and in our small little team that we have in the governor's office, if they come into us, then we got no other resources. We're working to try to fulfill all of those requests, and I would say that some of them that have come in. If it was paper versus electronic, it would take pickup loads. You'd be filling up the back of pickup loads with paper on some of these requests, because some of the requests are so broad. It's sort of like basically tell us everything about everything that's happened since the beginning of the time that this began, and we'll work to fulfill those. It's our duty to try to fill those requirements, but they're not necessarily easy, and sometimes they're so broad they're not very specific, and so that's it takes time and effort. We'll do it. We are all in on transparency, and again, even as I read some of the requests that have come in, I am know that things that they're requesting is stuff that we have already shared publicly. So it's a little interesting to get a Freedom of Information request for stuff that's been shared over and over and over and over again. So we'll just keep working through it and make sure that all the data is public and transparent. Going forward, we're happy to do that. That's our job. We operate in the open and in the light. And I think that if people want to understand about how decisions get made, I think that one good way to do that would be to watch the tapes of all of these briefings, because we have all of your questions and all of the decision making and the thought behind it and the modeling and the data ultimately right here in relative to the state, it's my responsibility, and I've tried to, as best I can, expose all of my thought processes to the whole state, as scary as that might be for some people, but we're putting it all out there and happy to keep doing that. Jacob?
Governor, in reference to the CARE-19 story, you've said this entire time that third parties aren't buying the data and whatnot. But at the same time, in the privacy policy for the CARE-19 app, it says that the data won't be shared with anyone, including government entities or third parties. But in the same privacy policy, it lists a few companies that say they are using that data. At the very least, is this not an inconsistency in messaging?
Well, I think there's been a slight revision to the privacy policy to try to tighten that up to make sure there is no inconsistency, but I think that... What's that?
This was about an hour before the press.
Well, hopefully you got the current one on there. Thank you for that. But the word sharing the data, because sharing the data implies that somehow the app is sharing personal data when there's no personal data on the app. And so then it's really the data from Foursquare is coming to the app because it's the name of that local, say again, coffee shop. Pick your local coffee shop, you go there, and then Foursquare will say, okay, they were at this local coffee shop. They send that data one way. The data's not going the other way. And so there's not sharing going on of any personal data, because it doesn't exist, and what Foursquare is providing a free service that they provide, again, through their software developer kit to any developer that says, if you want to get the name of the business that you're standing next to, we'll send it to you for free. And if they had a ID, a 32 random ID number from the phone that identified the phone, then Foursquare discards that as part of their privacy policy. They don't keep it, they don't use it, they don't market to it. And so we'll make sure that that's super consistent, but there's nothing, in the way I think about personal data, there's no data being shared. It's not being collected by the app, and if you don't collect it, you can't share it. So, in all
fairness, it doesn't say personal data specifically, it just says data.
Yeah, well, data is pretty broad, and would be data related to somebody's phone, we don't know who it is here. That would be also considered data. So there's somebody's phone was at the coffee shop for 10 minutes, and now we're going to say this is the name of our coffee shop. We're going to send it to that group. We send them the name of the coffee shop. So they're the ones that are sharing data that's actually usable, like the location and name of a business, but there's nothing about the individual that exists to be shared with anybody else. So that's the part that's but again, any other, you go shopping online, you go shop online, that data is, bought, sold, used by all kinds of people. CARE-19 is not in that business and doesn't profit from it. So I love the deep scrutiny, and I love the fact that maybe people are getting educated about how these free business models work, but I tell you, there's nothing there on this CARE-19 story, because I mean, I'll just stop there. I was going to, because I'm impressed by how cost efficiently this has been developed by the state of North Dakota versus other states that are spending millions of dollars on apps. And we've got one that is completely private and it's free to the user and nearly free to the state of North Dakota. So good spot to be in my mind. I'm going lane, then we're going online.
Governor, with the high numbers lately, I know you guys have said you've expected that with the targeted testing, but you've also said that we're kind of lagging behind the rest of the country in numbers, and was wondering if you thought it's possible that we might be actually hitting our peak now instead of previous.
I think the key thing to keep looking at is the percentages, not the raw numbers. I mean, if we have, 90 positives today out of what was close to 2,300, 2,400 tests. 3.6% I think was the, or 3.5% was the percent today. As long as we're in those low single-digit percentages, then and we are being very targeted. As I said before, in those early days when we were hitting 2,000 tests, we were getting some of those. 1,000 of those people were the worried well coming to a drive-through event, and we were getting almost no positives out of that. If we're contacting people who live with or work with people who are positive and saying, please get tested, and in a targeted fashion, if we're going into long-term care centers and testing everybody where there's, that's a potential high area of prevalence, and we've only getting 3.6% of the people coming back positive, you got to feel great about that, because I feel good about our numbers in a percentage-wise. I also feel good that we're, per capita matters. I mean, we're doing testing, only one state, Rhode Island, home of CVS, is doing more testing per capita. Only one state has tested a higher percent of the population, and we're doing that in a more targeted way, because some of the numbers in other states may be driven up also by drive-through testing, where we know that we're kind of past that phase and we're doing the targeted. So highly targeted, low percentage, great spot. You want to focus on Cass County, because that's just, that's one spot. If you got 82% of the positives coming from one county, we've got to keep driving resources there, and we are. And again, statewide, you saw in the numbers yesterday or on Wednesday where we had cases pop up like in Glen Ullin and New Salem and in Mayville, in long-term care facilities where you get 10 to 20 positives that show up between staff and residents in long-term care. That's why our whole focus with Chris Jones and the most vulnerable population, statewide, about 20% cumulative of all the positives have been in long-term care, 80% outside of. But that's that in long-term care. A month ago, only about 10% of the positives were in long-term care. Now it's 20%. It's 20% probably because we're doing targeted testing in long-term care. We're really getting in there and really understanding that. And within long-term care, the split is about 11% plus, or getting 11 to 12% staff and 8 to 9% residents. And so again, when we have that information, it helps us really focus on how do we keep staff safe, the healthcare workers that work in long-term care. So I like the numbers. I like the direction. I like where we're going. The only one I don't like is I'd like to see Cass County start figuring out a way when we can start turning the corner there and getting that number lower. But if we find the positives and those people are isolating, that's the way we're going to slow the spread. I want to thank everybody, the mayors, the county, the local Cass Public Health. Those guys have been working very hard the last 2 weeks, and we're getting great collaboration from employers, where if employers find that they've got 1 or 2 positives, they're inviting us in, particularly in manufacturing, to test everybody that works there. And this is a reason why I think with that kind of collaboration, why we've not been reporting any large outbreaks at a manufacturing plant so far in Cass County, because of the responsiveness of employers wanting to take care of their workforce. So good progress, good collaboration. We'll increase the focus, increase the effort, and again, I want to thank the testing teams that made it all the way around the first thing through all the 218 long-term care facilities. We'll be back again. We've got to go back through all those long-term care facilities again, and staff again. It's not a one and done. It's a keep going back, and we want to keep going until we know that we get zeros in those long-term care facilities, because that's the path to reopening. And we know that there's a lot of pressure to let's get visitation going in long-term care. And we want to make sure that we've got the ability to do great testing. That could even mean weekly testing at long-term care as part of that reopening plan. But thanks for your question, as always. Dave, that was a very subtle. It was like a high-end Sotheby's auction kind of hand raising there. Yeah, that's right.
In an earlier briefing, you talked about trying to do more public-private partnerships with labs. Have you had any action on that? Have you had any positive response to that?
Well, I would say from the healthcare system, Sanford has played a role with their Sioux Falls lab with a percentage of tests every day going there. Essentia, when I talked to Dr. Bill Heegard, who runs the West Division of Essentia earlier this week, they're ramping up some of their capability. And so in addition to what they might be doing on point of care, they've got a lab in Duluth that they're sending some facilities to. Altru in Grand Forks has had a long partnership with Mayo. And so some of the Grand Forks testing earlier on was going to Mayo. Now that the Grand Forks numbers have dropped, some of the testing numbers have dropped. So those would be on the private side. The state of North Dakota is working with one national lab, and we're doing a test to send some samples there to see if we can be guaranteed a 48-hour turnaround in terms of results. We could have more information on that next week if that works. And then also, there's a terrific biotech company in North Dakota, Aldevron, which is in the biotech space, and they've got some of the biggest, most beautiful labs in the state, and they're working with people all over the world that are working on vaccines for this and other infectious diseases. And so we're going to be having a meeting with Aldevron on next Tuesday, and we'll try to keep discussions there. I think there's opportunities with the universities. That's more public than public-private, but we've identified that there may be some underutilized lab space at UND or at the medical school or at NDSU, pharmacy, public health that could be tasked. So we want to come up with a long-term strategy where we're, right now 80% plus some days of the tests are being done at the North Dakota State Lab here in Bismarck, and we've brought in two mobile lab trailers that are set up outside, so we've run out of physical space. We've got these, they're designed, think of them as sort of semi-trailer labs that come in, and they get rolled off. There's not wheels underneath them, so they're mobile, and that when they're done with them after a period of time, they could be moved. That's not a great long-term solution, and I think, again, a vision where we might have more distributed labs, tighter connections with higher education, and some of the capacity going to the private sector would make sense. Because again, when we're going, we don't want to end up 2 years from now with a lab in Bismarck that can do 20,000 tests a day, and then we don't have demand for that. It would be better risk management for the state to have this be distributed, and if some of that investment goes into higher education, it could have long-term uses for research. So we're being thoughtful about how we scale capacity, but in the meantime, we're still in an emergency, and we've got to keep driving it up. And you've seen that we're trying to get to 4,000 tests a day. We're not there yet, and so we got more work that we have to keep doing to hit the goals that we'd set earlier. Okay, I'm going Jacob, then online.
Governor, back to CARE 19, while your position has been one that you seem to be fully aware of the situation at the time, at least Vern Dosh, your contact tracing liaison, told the Washington Post that they should have vetted the app. Which is it? Should the app have been more vetted, or has the state been fully aware of this the entire time?
Well, I'm not sure exactly about that. If that was having been interviewed by the Washington Post before, I'm sure Vern said things before and after that quote that was parsed out. So I can't take the full context of his answer. But I would say if there's a key responsibility here that could have been done is that we could have done a better job of updating the specificity in the privacy policy that explained how data was coming one way from Foursquare to the app, and then there was also a couple other diagnostic tools that were being used by ProudCrowd, again, not using anybody's personal data, but they were using that, and we make sure that we got those disclosures, and we've got those, I think, fixed in the privacy piece, but there's the intentions were always clear, and the design was always solid, and no personal privacy. There's no breach. There's no possibility of a breach because there's no personal data there. So I keep getting curious about why. Again, you can tell I'm partially amused by the interest in this, and I can't even speculate why it would be, but it's when there is entire industries built around using and selling people's personal data for advertising purposes, and that is not the design, the intent, or the capability. It would be impossible the way the app is designed to actually do that, because there's no phone number, there's no address, there's no email, there's no registration, there's no nothing in there. And so so that's the, and again, the gotcha in this case came from a company that is in the business of trying to scare people about you need more privacy, so buy our thing, so you'll be more private. So there is actually an economic motivation for this group to do what they're doing, but that's the world out there in the big competitive world. I lived in it a long time. I understand it. I'm right now I'm amused by it. Okay, we're going Amy and then online.
Okay. I have just a quick two-part question about the Capitol reopening on June 1st. When employees and when the public comes in, will they be going through the same sort of temperature check and screening question process that we go through when we enter the Capitol?
Yes.
And then I'm just envisioning, 8 a.m. or 9 a.m. whenever, workers show up here, a lot of people filing in at once. And are there going to be efforts to have multiple stations set up where they could go, or keep people spread apart so they're not all lined up right next to each other? What's that going to look like?
I'm certain that the people working on the continuity of government have thought that through. And the other thing, of course, we would I'm sure that group that's working on this, specifically as relates to the Capitol, would be encouraging people to have staggered start times to avoid that kind of crush of coming through. And good reminder, if we haven't, we'll make sure we do, because there's no reason, again, that we shouldn't be trying to space that out. And again, we anticipate it when we start out, it's going to be 50% or less capacity, because a lot of people have adopted to working remotely in a really highly productive way, and some of that is certainly going to continue going forward.
Okay, and then the temperature check that I think we've all gone through, is that an infrared process, or do you know? I haven't been participated in the media temperature check policy or practice, but are they putting a little thing on your forehead? Is that what they're doing? No, you stand out in the hallway and you open your mouth, and about 6 feet away there's a little device that takes your temperature somehow.
Okay.
I'll ask when I...
Okay, all right, good. That'd be good. I'm assuming infrared seems like a good guess, and I don't think it's ultrasonic. I don't think it's that. I think infrared would be more on the heat thing, but we'll, lots of different ways to detect things. Okay, we're going online.
Scott Hennon, WZFG KFYR Radio. Of today's 90 positives, do we know how many were from contact tracing or focused testing versus those who presented with symptoms at a clinic or hospital? And is that number going to be provided?
Scott, somebody knows that number. I don't have that right here in my briefing, and that's not one that we have. Not one that we have released in the past, but we'll take a look at that, because again, we're trying to always get more granular with the data release. We think that as long as we can protect personal privacy, that would be one I think we could share without affecting any HIPAA laws. So that would be one for us to look at. And I think we are sharing. I believe are we sharing the data around number of cases that are in long-term care that's out there? And so you could net those out, because those, I wouldn't call those, for Scott, I wouldn't call those contact tracing. I would call those targeted testing. But when we go in and test a facility and then we find a pocket of those like we did a couple of days ago, then that bumps up our numbers for the day. But we disclose all those that are both long-term care residents and long-term care staff. Okay, I'm getting a signal. I either got the victory sign, or it's from Mike, or it's 2 questions remaining. But how many do you have left online?
3.
Okay, so we're going to do 4 more. We'll do the 3 online, and then Dave.
Gene Schemp, Hometown Radio Group. There were 26 positive cases uncovered at this week's mass testing event in Minot. 100% of those were asymptomatic. Do you know if the rate of asymptomatic positive cases is increasing, and might those be false positives?
I don't know if they're false positives. I do not believe they're I do not believe they're increasing, but we could check on that. And from other data that I'd seen, we were, again, could vary by age group, but we're seeing, some cases it's not, it'd be unusual in that case to have 100% of them be asymptomatic, but we've had other batches where, 30% and 30 to 40% come back sometimes asymptomatic. And so that's, one of the challenges in trying to track this thing down is people have it and maybe spreading it and don't know they have it. So again, that's what contact tracing can lead us to people who have been exposed to people that we are known positives and maybe symptomatic, and then we get to someone who is asymptomatic and maybe they're going to become symptomatic, but we catch it early. It's always fantastic when we catch somebody who's asymptomatic, because that's one way we're probably really slowing the spread. But good data questions, Gene. My team's writing these all down, and we'll keep digging. Love the curiosity. Okay, next question.
Thomas Simon, Williston Trending Topics. The drive-through testing event in Williston yesterday had just 189 participants. Do you have any ideas as to why there was such a small turnout, and is this a good or bad sign?
I don't know what the goal was, Tom, so I won't try to characterize where it was good or bad turnout. 189 testing through an event like that is solid sample. And again, anybody can get tested in Williston or any place else, all the places around the states. You don't have to wait through drive-through testing. If you feel even over this weekend, call your provider. If you're feeling symptoms or if you've been exposed to someone who's positive and you're concerned about it, call your provider and go get tested. Lots and lots of test kits all over the state. But when we can, come in and coordinate with a local community public health like that and pick up another close to a couple hundred tests, that's a good thing. And so again, just say thanks to everybody in Williston for participating in that. The question on why there may be lower turnout, Williams County has been fairly low on number of positive cases, and I'm not even sure if there's been a death up there. And so if you've got I think we see more demand for testing if people feel they're surrounded by the virus, or if they know people who've passed with COVID-19, they've probably got greater awareness. We know in states where there have been a lot of people that have passed away, there's higher inbound demand for people getting tested. I think that's just a natural psychological thing, where here we might feel like, if it hasn't been here, why should I go even if I'm not feeling well? So maybe we've got less demand. But again, encouraging people to go get tested if you need to. Okay, there's one more.
April Baumgarten with the Forum of Fargo-Moorhead. I know you were trying to promote personal choice, though I can see the emotion in your call to avoid the mask, no mask divide. You've been very calm during this time. Could you speak to kind of the emotion behind your words while talking on the subject?
Well, I just think it's important. We hear a lot of voices in the governor's office from and we get lots of input from lots of different people, and as we sift through all that input, sometimes there's some really touching stories from individuals, and I think that in our state, again, we've got a general view that this is something that is it hits old people, which it does, older people and people with underlying health conditions, and we forget that there are, children in our state and in our school system that may have gone through, tragedy of childhood cancer. They may have other underlying issues. You could have, someone who's got cystic fibrosis, which until recently, if you had that disease, the life expectancy was about age 30. If you're someone that got dealt the wrong card, either through a genetic disease like cystic fibrosis or some unexplainable cancer, then COVID-19's not a joke. It's not something that should be laughed off. It's not something like, oh, they're taken too seriously. To those individuals, this is a matter of life and death, and because it is, again, it can be really horrible, tragic and deadly disease for people that are that have those underlying conditions. So again, I just think that when we see people with a mask, the first thing that somebody ought to assume is that they're doing it because they've got people in their life that they love and that they're trying to take care of. And I just think let's just start there, and then drop the judgment. in North Dakota, we find our better selves, I guess is what I would say, and think about that, because some people may be out in public, they may be out shopping, they could be shopping for an elderly couple that's a neighbor, doesn't have to be a family member, but let's just start with empathy and stop with the mass shaming. Okay, Dave.
Just a real quick question. Why not the Heritage Center being open?
I think we'll see the Heritage Center opening coming soon. You're going to see that. I think we just want to make sure that we've got the staffing and the protocols and all of that right. And but there's no reason why we can't get that back open again. Does that wrap it up? Okay, again, so thank you for being here on a Friday afternoon. If those of you that are tuning in, thank you for staying with us the whole time, and also be safe, drive safe, be safe, and be sure to remember those that gave the ultimate sacrifice. Take time on Monday, even if you don't attend an event, maybe with your family, teach your kids what the real meaning of Memorial Day is, and take a moment of silence and think about those folks that served our country and fought for the liberties and freedom that we're still fighting for every day. The fight for freedom never ends, and it's alive and well here in North Dakota. Thank you all.